Hi, my name is Dr. Natasha Hastings, owner of Athletic Edge Physical Therapy in San Diego, California. I'm continuing a series for pelvic floor strengthening and diaphragmatic breathing. So check back to those previous videos if you haven't to make sure you have the base foundation to build up to this point. Now in this video, I'm going to be describing how we can further engage our lower abdominals, our external obliques, and our internal obliques. So first I'm going to talk to you about what our external and internal obliques do. So if you place your hands here, those are those little oblique muscles that fire. So as you turn, our external obliques, let's say, are here, right? So as we turn, this one is going to shorten as we turn to the right, and this one is lengthening. You could feel it. So if you place your hands kind of on your low, like you have pockets here, and you feel right there, you're going to feel the right side lengthen and the left side shorten. So as you're rotating to the right, our left external oblique is really pulling and our right external oblique is lengthening and controlling that turn as well. Now, if you reverse it and put your hands like this into another pocket, you're going to feel different obliques firing. So those are going to be your internal obliques. So same thing, if we go to the right side now though, you feel the right side shortening and the left side lengthening. So as we turn to the right, our right external oblique is firing eccentrically and the left is firing concentrically, meaning the left is pulling you. And as you go to the right, your right internal oblique is firing concentrically. It's pulling you in and the left one is stretching out. So both basis of the story is both your internal and external obliques are firing and need to be moving equally and proportionally. Now to get going on this exercise, we're gonna start in hook line. So first lay on your back and you're just gonna place your hands on your lower abdominals, like right inside your pelvic bones here. And first, we're going to find that transverse abdominis muscle, your deep abdominal muscles. And to do that, you're going to first inhale, do the 360-degree inhale, breathe out, pull your front pelvic floor musculature up, and then I want you to just lift your head just ever so slightly, and you're going to feel these muscles pop under your fingers here. That's your transverse abdominis. So go ahead, try that. So breathe in. Exhale, pull the front pelvic floor muscle up, not just the back, not just the anal area, and then lift the head ever so slightly. Good. So that's your transverse abdominis. And some of us, that pops up right away and it's very tight. Now, to get our external obliques, we're going to put our hands just a little bit higher in that front pocket phase there, okay? And as you inhale, exhale, pull pelvic muscle up. I want you to slightly pull your rib cage down and lift your head. That's your external obliques, those muscles that are going down and in, like the rib cage. A lot of people who have a wide, seem to flare out at the ribs at the bottom, I do, means your external obliques haven't been firing or taught to fire up until this point, and your internal obliques have been firing way too much. So this is a great exercise, especially if you notice yourself having a wider set rib cage at the bottom or flaring up rib cage. So again, to do that, we place our hands just below our bottom ribs, kind of like lower rib cage and the space below. Inhale, exhale, draw the pelvic muscles in, push the rib cage down, and lift your head. So we're getting TRA and external obliques. Inhale, relax everything. Exhale, draw the pelvis up, push the ribs down. Remember to keep your shoulders relaxed. Again, we're focusing on quality, not quantity. So I want you to do these until your heart is content. You don't want any pain. Again, you're not pulling out of your neck. Imagine that there's a string at the crown of your head pulling you upright. The string is also pulling your chest up. If you get neck pain, reset. Pull that string out the crown of your head, okay? Inhale. String is pulling your chest up, and we're contracting everything here. Good. All right, so now to accentuate that, well, I should say to progress that, we're gonna go into a half kneeling lunge, and I want you to do this on a soft surface. I like to do a pillow to protect my knees. All right, so as I was saying, our external and internal obliques really fire to twist us. So this next exercise, you're going to go into half kneeling. If you find that your hip is hiked on one side, and draw that heel back isometrically, contract that hamstring because that will draw that hip down, okay? And if you have a really tight hip flexor, just ease up on this. Again, you don't want to be dumping your pelvis forward. We want to be nice and neutral, maybe with the pelvis tucked just slightly. All right, so what we're going to do in this is those internal and external obliques, remember they pull our rib cage down and turn us. I don't want you rotating your whole low back, so there's none of this like big rotations. Okay, so you're going to just breathe in, pull that rib cage down, and just rotate the ribs. You're almost fighting this rotation. It's a very minimal rotation. Breathe in. And exhale, draw the pelvis up and rotate over just slightly. Not a very big movement. And then switch sides, doing the same thing. Now, if you want, just like with the standing lunge, you can add a band in for more progression. Okay, so what I'm gonna demonstrate here, I'm just gonna hold the band here. And again, you want the band to be perpendicular this way. You can have it more backwards, that's gonna work our muscles differently. You can have it more forward, that's gonna work the muscles in a different area. Our muscles and our body is a great thing. That's why you can do things so many different ways. So again, I'm going to contract my hamstrings, pull my hip down, make sure my hip is not hiked. Okay, so nice and even, my pelvis is tucked under. We have a neutral body here. Okay, I'm gonna inhale, 360 degrees, exhale, tuck my pelvis floor up, and rotate just my rib cage. Just my rib cage, a very small turn. Inhale, come back. Okay, and this line of tension is staying right in line with my chest. A lot of people will do this all day and they're like, oh, I can do this, no problem. That's an arm workout. You're not focusing on the core here. If this is too hard for you, bring it in closer, shorten the lever arm. Okay, inhale, exhale. Draw that pelvic floor up and turn ever so slightly. My elbows are staying tucked into my body. Just the rib cage is moving around my waist. My lower spine is not rotating. You can also just hold this out and lift your arm up and down to fight that rotation. Again, inhale. Exhale, draw the pelvic floor up. You may find an area where you start to come off kilter, and that's an area where you need to hold it and work on. Okay. If you're rotating, when you're doing this, you want to feel both your obliques. Remember, we have internal, external obliques here, internal, external obliques here. You want to feel both sides firing because they're both working to turn us. If you feel one side is firing more than other, or say this side isn't firing, tap it. That'll wake the muscles up, or tap this side. Whatever side you don't feel, just tap it a little bit. Okay, an important progression to add on to that is you can stand up into static lunges. So an important part of our pelvic floor musculature is that our hip, this muscle, internally rotates. So internal rotation, the whole leg is spinning in, external, it's spinning out. So if we spin it in and internally rotate, that's gonna assist with that pelvic floor TRA contraction to push air out. So first I'm going to show you without any resistance, okay? So you're going to step forward, say with your left foot, okay? My right foot is behind. And you're just going to drop that knee in. So it's going to internally rotate and adduct. It's going into your body, okay? And my left leg is not moving out as well. It's just going straight down. So I'm going to breathe in, 360 degree, and then exhale, pelvic floor pull up, and let my back right knee drop down, internally rotating. On my inhale, I'm gonna come back up. So as I'm exhaling and I'm dropping down, I'm getting a slight stretch on the outer hip of this static leg. And coming back up. Good. Let's switch legs just so you can see again. So I'm going to inhale, 360 degrees, exhale, pelvic pull up. Drop my opposite knee down. Getting a stretch on this outer hip. Remember, keep your shoulders relaxed as well and back. Be careful not to keep your torso upright so hard, okay? You can let it come forward a little bit. And for repetition range, I don't really want you to focus on reps. I want you to focus on the quality of your breath, your pelvic floor contraction, and the quality of the movement. You don't want to move through these fast. You can even hold on to a chair if you need to for support. And then just do them until you feel you've had enough on one leg and then switch the other. Now you can always add in a resistance band. I put a band around my doorknob here, and what I'm going to do is I'm going to pull the band this way as I'm dropping my back leg in. So I'm going to inhale. Come back up. Remember to draw that pelvis up. It's a lot of things, a lot of components going on at the same time. So again, quality over quantity. Once you get control, then build up the quantity, then build layers on, but you must get the base foundations first.